Nutrition during the first 1000 days plays a major role in the health of both mother and child. The 270 days of pregnancy and the first 2 years of the baby's life makes it a total of 1000 days of shaping the future. Nutrition during these 1000 days lays the foundation for a healthier and smarter generation. Gut discomfort and the role of breast milk. Today, we will learn about a common problem among infants, which is gut discomfort. We will also discuss in detail about the most common types and how breast milk helps in managing the same.
Hey, what happened? Why she's crying so much?
No idea, I don't know.
Don't worry. Let me call the doctor.
This is not an uncommon situation. Through my career, I have received countless such calls from worried parents, some of them even in the middle of the night. An inconsolably crying infant can be really terrifying for parents. There can be many causes for this situation, and gut discomfort is one of the commonest. Hi, I am Dr. Gaurav Sethi, a pediatrician practicing in Delhi, and today we will discuss gut discomfort in infants and how we can help in addressing the same. Functional gastrointestinal disorders like infantile colic, regurgitation and constipation are the commonest cause for gut discomfort, with more than half of all infants suffering from at least one of these conditions. In fact, these disorders are one of the commonest reasons for parents visiting doctors like me. These disorders do not have a definitive cause, although they have been linked to immaturity of the gastrointestinal tract. Even though most infants tend to grow out of these problems, lack of a definite treatment causes a lot of distress in parents, leading to misuse of drugs, a hunt for alternative therapies, and frequent changes in infant feeding practices. Now let's first briefly understand these disorders one by one. The classical picture of infantile colic is of a healthy and well-fed infant who is inconsolably and continuously crying for no apparent reason. And this child seems visibly irritated and fussy. The symptoms tend to aggravate during the evenings, and it affects 10 to 40% of all infants. It peaks at about 6 weeks of age. Colic is defined as unexplained crying for more than 3 hours per day, more than 3 days per week, and longer than 1 week. In regurgitation, infants bring up contents of the stomach into the mouth and sometimes expel them out of the mouth. It is effortless and it is non-projectile. This is considered as a normal physiological process and may occur several times a day. Nearly 50% of all healthy Indian infants regurgitate at least once a day. And it gradually abates in around 9 of 10 infants by the first birthday. Children with constipation pass stools less than thrice a week, or they may have painful or hard bowel movements. This may be associated with irritability or loss of appetite. most infants with constipation do not have any underlying disease, and more than 60% get better by the age of 1 year. Now, how do we manage these conditions? For infantile colic and regurgitation, we advise proper burping and positioning of the infant while continuing breastfeeding. Doctors usually try different digestive enzymes and probiotic drops for colic. On the other hand, regurgitation does not require any active management if the infant is gaining weight adequately. There is no specific treatment which is routinely recommended for functional constipation, and the mother is advised to continue breastfeeding and to start toilet training once the infant is able to sit without support. Could nutrition have a role to play in these functional gastrointestinal disorders? Proper nutrition during the early years can help establish a normal gastrointestinal function and be instrumental in the prevention and management of gut discomfort in infants. Talking of proper nutrition, what is the best form of nutrition for infants? Yes, breast milk is the gold standard for infant nutrition up to the age of 6 months. It provides all the necessary nutrients for growth, appropriate growth factors, and the right immunological components, as well as goes a long way in alleviating gut discomfort. Breast milk supports gut comfort in infants through a unique set of nutritional characteristics that include high lactose content, a whey to casein ratio of 60:40, a calcium to phosphorus ratio of 2:1, and optimal osmolality. Let's talk about lactose first. Human milk contains double the quantity of lactose than any other mammalian milk. This optimal lactose content has a positive effect on stool consistency through its osmotic laxative effect. It helps in better absorption of minerals like calcium, zinc, etc. Helping in the synthesis of cerebrosides and myelin makes lactose a very important nutrient for brain development. No wonder then breastfed babies have an IQ 8 points higher than those who are not breastfed. Lactose also helps in the formation of good, friendly gut bacteria, which are also called probiotics. These good bacteria improve our immunity and help prevent certain diseases and allergies. Now, breast milk also has an ideal whey to casein ratio of 60:40, which has a beneficial effect on gastric emptying and stool consistency, thereby reducing episodes of regurgitation and constipation. It also supports a healthier gut flora. The optimum calcium to phosphorus ratio of 2:1 in breast milk leads to better calcium absorption and at the same time plays a major role in maintaining ideal stool consistency. Osmolality is the one which determines the levels of water absorption in infants. Breast milk has an ideal osmolality of 300 milliosmoles per liter, which is favorable for regular bowel movement. Unfortunately, despite knowing all these benefits of breast milk, some mothers are unable to exclusively breastfeed their children for 6 months. In such a situation, many parents choose cow's milk as a substitute. this is definitely not the right thing to do. There are many reasons why unmodified animal milk should not be used in infancy. Cow's milk is a poor source of iron, thereby hampering the infant's overall development. It has also been known to increase the risk of allergies. The lower lactose content in cow's milk leads to poorer mineral absorption and lesser substrate for the beneficial bacteria. Unlike breast milk, cow's milk is casein predominant with a whey-casein ratio of 20:80 as against 60:40 in breast milk, as we've just discussed earlier. This increases the risk of constipation and hampers the growth of good bacteria in the intestines. A less than desirable calcium is to phosphorus ratio of only 1.3 in cow's milk again increases the chances of constipation in the infant. Higher protein and mineral content of cow's milk leads to a high renal solute load, which can predispose to fluid loss and dehydration even. Add to all this the possibility of adulteration in cow's milk, and you get the picture as to why it is not the ideal substitute for breast milk. Now let's try and briefly summarize whatever we have discussed. We realize that infantile colic, regurgitation and constipation are a very common cause of gut discomfort, and they affect over 55% of infants below the age of 6 months. Since mostly their causes remain unknown, they are referred to as functional gastrointestinal disorders. Breast milk remains the gold standard for the prevention and management of gut discomfort. Considering all that we have learned today, it becomes imperative on our part to leave no stone unturned in trying to convince mothers to exclusively breastfeed their infants up to the age of 6 months. And when, despite our best efforts, some of them are unable or unwilling to do so, to recommend the right alternative. An alternative which comes closest to breast milk in its contents and its performance. An alternative which supports gut comfort by resembling breast milk, especially when it comes to lactose content, whey to casein ratio, calcium to phosphorus ratio, and osmolality. Infant formula and not cow's milk provides this right alternative to us. I sincerely hope that you not only followed whatever we discussed, you also enjoyed it as much as I did. You, my friends, have a very important role to play in counseling of parents and guiding them in making the right decisions for their infants. I trust the next time an opportunity arises, you will put this knowledge into good use, both while attending to a little one who is crying and is wailing away with gut discomfort, and while recommending an alternative feed for infants when breast milk is not available. Take care and all the best.
What are the 3 most common causes of gut discomfort? Infantile colic, regurgitation and constipation. What approximate percentage of infants below the age of 6 months are affected by these FGIDs? 55%. Among all the FGIDs, what is that one common advice we should give to mothers? Continued breastfeeding. What is the gold standard for nutrients in the prevention and management of gut discomfort? Breast milk. How much lactose does mother's milk contain as compared to any other mammal? More than double. What are the benefits of lactose? A. Better absorption of necessary minerals. B. Better stool consistency and less constipation. C. Brain development. D. All of the above. What is the whey-is-to-casein ratio found in mother's milk? 60:40. What is the calcium to phosphorus ratio found in mother's milk? 2:1. What is the optimal osmolality that mother's milk contains? 300 milliosmoles per liter. Is cow's milk the right alternative to mother's milk? No.